So you might ask, well, what should you do? One of the things that I think is really interesting is how you answer that really depends on where the enterprise wants to go. So there's no cookie cutter answer to say, well, you absolutely positively need to go after consumers because that's where everyone's going. Or you absolutely should do, private exchanges because that's the right model, because it really depends on what the strategy of the organization is. But I think there are a couple of, I'll call them almost universal considerations, regardless of where you're heading, that really should come into play when we're thinking about this. And the first is, regardless of where you sit in the market, the landscape is changing, the competitive landscape. We see companies that you might, never have even heard of that are coming in with functional capabilities, things like ZocDoc, which makes scheduling easy. And I don't know about you, but I've gone through the pain of trying to get an appointment booked, so it's nice to know that there are solutions out there that can help. So the competitive landscape is changing for everyone, regardless of what you're looking at. I think another point that's really just an important consideration is that consumers are bringing their expectations from other places in the market into health, right? So just because health hasn't had as much of an orientation around the individual historically, having been a group business in insurance, it doesn't mean that I don't bring what I know from my Amazon experience into health. I think it's really interesting when we see things like the Forrester Consumer Experience Index showing, Amazon an 88 rating, and the highest rated health plan is at a 76. So the gap between expectations and the top performing health plan around experience are really high. So I think the second point is really thinking about how you need to bring in those considerations from elsewhere. I think the last thing, though, is that while we all know that price is increasingly important as consumers take on more responsibility, even if they're getting employer-sponsored insurance, but your price is how you get them in the door. But Accenture research shows that it's definitely not how you keep them. And what we've seen in our healthcare retail consumer study is that around 76% of respondents said that in order to be a brand advocate for the health plan, they needed to believe the health plan was innovative. So as we think about the transformation in the marketplace, I think that the considerations that really come to mind are all around the competitive landscape, that consumer experience piece, and thinking about the role of innovation.